Hi, everyone. I'm Dr. James Miller, family practice doctor, as well as sports medicine doctor. I sit on the World Aquatics Sports Medicine Committee. I also chair the Pan Am Medical Committee. Selena Shaw is our guest presenter today. She serves with me on the World Aquatics stage and has done some amazing job with us. It's interesting her background, though. It's not just in aquatics. She's got a broad background, which serves us well in this presentation. That includes the professional ballet. She's from Walnut Creek, California, so she works with ballet. She works with artistic swimming. She works with gymnastics. She works with lifting, and she also works with figure skating. So, what a background we have here, and we're so lucky to have her giving the topic of distinguishing between injury and soreness. We've all had that question. When we've been competing, or our athletes have been competing, they complain of that sore shoulder or that sore side or that sore ankle or whatever. Is this represent an injury? Or does this represent simply soreness because of technique or because of a sudden increase in the volume load of training? So I'll turn the podium over to Selena. And Selena, thanks so much for being here with us. And it's great to have you. She is a Pan Am Medical Committee member also. So it's great to have you. Thanks so much. At the end of this, or as we're going, if you have a question, raise your hand and we'll address that. You'll see that there's simultaneous translation going on. So that will be very clear to everyone as to what your question is. So thanks so much for being here. And Selena, it's all yours.
Thank you so much.
Sorry, one note before fully turning it over to Selena. If everyone could pick their language as either English or Spanish, then you will hear all translated questions and answers in the appropriate language. And now it's all yours. The floor is all yours, Selena.
Thank you. Thank you so much, everyone. Good morning and good afternoon to all of you, and thank you for taking the time to join. And thank you to Pan American Aquatics for allowing this series to occur. It's fantastic to be able to connect with people all over the world. And thank you for the kind introduction, Dr. Miller. So we are going to talk about how to distinguish between injury versus soreness. And as Dr. Miller said, this is a burning question among so many, not just athletes, but really anybody who is active and exercising. And so I really enjoy giving this talk, mainly because it's also very interactive. So I definitely want all of you have your cameras on. I'm going to be asking questions throughout, even starting from the beginning. And so what you can do is use the raise your hand feature, and you'll be unmuted to be able to shout out the answer. We'll let everybody for each question have 3 chances, and then I'll give the correct answer. And if you have any questions throughout the talk, definitely raise your hand and you can be unmuted, and that way we can just go through and address questions during the talk, okay? So to go through this, the outline of the talk is going to be, first we'll go through some very basic anatomy. This is, again, going to be pretty interactive. We'll talk about different injury types, define them, what are different types of injuries. We'll talk about treatment options. And at the very end, we'll take some additional questions, okay? All right, so starting off, basic anatomy. Here's your first question. How many bones are there in the human body? Go ahead. And you can even unmute if you want and just shout out the question, because it's a very quick, simple question.
Yeah, everyone go ahead, unmute yourself if you want to take a stab at how many bones there are in the human body. Or throw it in the chat if it is easier in this case. But we want you to participate however you feel comfortable.
Mm-hmm. Great.
No, we have one person in the chat,
All right.
207, 206.
All right. Yes. 206. Very good. But don't ask ChatGPT. Try to see if you know the answer. Okay. The next question is, how many muscles are there in the human body? So this is not one that people really think about very much. So there's 206 bones, but how many muscles are there? We have anything in the chat?
800.
Okay.
500, 600 approximately.
Okay. 640. Very good. Close. I like it. Okay, so how many, well, what are joints? Do you all know what joints are? Okay, so I'm going to give you the answer on this one. So they're basically where the ends of bones meet. Okay, so now that you know that, how many are there in the body? Anyone know? Any guesses in the chat?
1,000.
Pretty close, 360. All right, but good. I love it. Thank you so much for participating in that. Okay, so we're going to go on now to what is a ligament? Who knows what a ligament is? You can shout it out. Any in the chat?
Nothing in the chat yet.
All right. So I will tell you what. Oh, go ahead, Victor. You're going
Oh.
to say, go ahead.
Yeah, in the chat we have one person saying union of where bone and bones connect.
Is the structure that makes that joint stable?
Yeah, so it's fibrous band of connective tissue that connects bone to bone. Very good. Yes. Okay, so what is a tendon?
The part that connects the muscles with the bones.
Yes, awesome. Thank you. Very good. So again, fibrous band of connective tissue that connects muscle to bone. What is the purpose of the tendon? So when muscles contract, right, they have a very powerful force, and those forces are transmitted to the bone to make the bone move through the tendon. Okay. So that's why those are important. And so you can see a diagram here. Here's your tendon. So this is your quadricep tendon here connecting to your kneecap or the patella. And then on the side of the knee, here's one of your ligaments, which helps stabilize the ligament from moving too far, from the bones shifting too far to that side. Okay, so cartilage then is a different structure, right? So this is also a type of connective tissue, but that lines the joints or cushions the bones basically between the joints. They have no blood supply and they have no nerve endings, okay? So what are growth plates? Anybody know what these are?
Yes, is where are the areas where the bone grows at the end of each large bone.
Yes. Okay, so these are areas at the ends of bones where growth occurs. Exactly right. Very good. I think you read my talk before. Very good. And they're made of cartilage cells, actually, that lay down bone. Okay, so when you take an X-ray, remember X-ray or radiograph only shows bone. So growth plates then, because they're made of cartilage, will actually look like spaces. And they're not necessarily fractures, but they're actual spaces on an X-ray. So what's interesting about growth plates is they appear at different ages in different bones. So this is an example of a foot where even just the different toe bones, you can see there's differences in ages. So for example, this one at the big toe, at the end of this long bone of the big toe, so called the first metatarsal, this appears at age 3, okay? Whereas the body of the growth plate of the second metatarsal appears at 7 weeks. So it's very interesting how the different growth plates will open and close at different ages, okay? And so some growth plates in the foot, for example, don't close until age 18 to 20. All right, so with that in mind, what's an injury? Now that you understand some of the basics of musculoskeletal structure, what is an actual injury? How would you define an injury? So when you think about it, it's hard to think about how you would explain it. Go ahead.
As a damage received from any structure.
That's really good. Yeah, excellent. So that's a great definition. So the way I've written it out is it's a medical problem that affects one's ability to participate in activity at a normal capacity, usually involving the musculoskeletal system, meaning the muscles, bones, tendons, ligaments, what we just talked about, but really can involve any body part. Okay, so you can even sometimes have internal organ damage from an injury as well that can limit you. And so usually there's pain involved. Sometimes there's just tingling and burning, depending on if there's just some nerve involvement. And so let's talk about pain. So physical pain, why do we need it? Well, it's the body's alarm system, right? So it's telling us there's something wrong and it's something that we need to pay attention to. But again, not all pain is necessarily bad. So let's talk about injuries then. So we define injuries by them either being acute versus chronic. And so let's talk through what those are, and then we're going to define these later. So acute, tell me what an acute injury is. What is your understanding of what that means? Anyone? Victor? I'm going to call on you because you're doing a great job, 100% so far.
It's when these injuries of short term.
Short term is good. That's a good way to define it. So it's something that happens suddenly with a single traumatic event. Okay, so very good. And some of the types of injuries that we can see and we're going to talk about are sprains, strains, fractures, dislocations, contusions, which are bruises, cuts, concussion, and then you've got chronic overuse, which is, what does that mean? Victor, I'm going to call on you. 100% so far. Very good. But you don't have to answer if you don't want to. So I'll throw it out there. So chronic or overuse injury is something that occurs over time. So it usually involves repetitive movements or trauma. And so you have things like tendonitis, tendinosis, bursitis, other inflammation conditions such as shin splints or plantar fasciitis. We have stress fractures, which actually fall in this category. They're the only type of fracture that fall into the occurs over time category or chronic. So with that in mind, then, what is a sprain? Who knows what a sprain is? How would you define a sprain? What body part does that involve, I should ask? Anybody know? Anything in the chat?
Someone in the chat just put injury to the ligament.
Yeah, correct. Okay, very good. So it's basically a stretch or partial tear or complete tear of the fibers of a ligament. Okay, so we define them and we grade them in medicine. So a grade 1 would be a stretch, a grade 2 would be considered a partial tear, and a grade 3 would be considered a complete tear. And so here's an example of a couple of the lateral ankle ligaments showing some of this. So this might be considered more of a grade 1. This might be considered a grade 2, where you can sort of see a partial tear there. So by that token, what's a strain? Who knows what a strain is? Does anyone know?
Someone put in the chat injury to tendon.
Yeah, very good. Okay, so it's a stretch, partial tear, complete tear of muscle or tendon fibers. So grade 1 again would be stretch, grade 2 partial tear, grade 3 complete tear. And so here we can see this as well on the hamstring tendon. Okay. So then a fracture is what?
Injury to the
Anything?
bone.
Okay, very good. So it's considered any break or disruption in bone. Okay, and so the term disruption is really key, and you're going to understand why that's important here in a moment. So a lot of times we'll hear synonyms like a break, a hairline fracture, a crack, a chip, and so the medical description really is it depends on how the bone breaks, okay? So we really describe fractures very precisely so that if we were to call somebody on the phone and say, hey, I have this patient who injured their bone and this is precisely what happened, then that other physician, if they were to see that patient, would be able to exactly understand and in their mind have a picture of what that fracture looks like. And so we describe fractures by their location, by the type of fracture, the angulation. So when bones break, the part of the bone will then get angled, right? Because they're no longer held in a straight line. And so we describe what that angle looks like. Displacement, so depending on how badly a bone is broken, some of the parts might be shifted. And so that's what displacement is. So we'll also be able to describe that. So here's a diagram showing you some of our fracture types and how we define them. So an oblique would be something like this that looks like a diagonal. Comminuted means multiple pieces, and those unfortunately usually require some sort of a surgery. A spiral fracture is this. You can literally look and see that it looks like it's spiraled. And then a compound, which would require surgery, is a complete break. Okay. So again, you can look at an X-ray picture and usually see these and define this precisely in terms of what this happened. And these fractures occur in different ways because it depends on how the forces are transmitted through the bone from the type of injury that happened. So we also have special fracture types. So um, some of you may be coaching pediatric, meaning children. And so what's interesting about pediatric bone is it's very plastic, meaning it's very easy to actually bend it. And so it doesn't necessarily break, but still a bend in the bone would be considered a fracture. And that's where I said disruption and not necessarily an actual crack necessarily always has to occur. So you have, for example, a torus or a buccal fracture, which there's some examples shown here where you can see this very subtle bend in the bone here. And so if you aren't thinking about this, you might look at this x-ray quickly and think, oh, that's just normal, that's fine. But really, it's not actually. Um, so that's what that is. And now you can also get fractures in a growth plate. Okay, so we talked about growth plates earlier. So we talked about those being cartilage, but we still consider those fractures because they still involve parts of the bone. Okay, and so what happens is sometimes with growth plate fractures, if they actually fracture directly through the actual growth plate, which again, you won't be able to see because it's an x-ray which only shows bone, you have to have a clinical suspicion that this still could be what's involved in terms of the injury. And so a lot of times we're relying on our physical exam, we get the x-ray, and then we can get additional tests where you can actually see growth plate fractures on scans like magnetic resonance imaging or MRI. Stress fractures then are what we talked about occur with time. So this is where bone gets overloaded and what happens, for example, when you're doing things like running and jumping, um, there's what we call bone turnover. So there's always a little bit of damage happening to bone. And so our body is designed to be able to get rid of the bad cells and just replace them with good cells. But with time, some people cannot do that efficiently. And so you end up with getting what's called a stress fracture. These aren't often seen on x-ray. Most of the time we have to get either a bone scan or an MRI. So again, if there's some suspicion that there's something wrong with the bone and it does not show up on x-ray, we usually will get some additional imaging to evaluate for these. Now, in the water, you might think, well, when are we going to get a stress fracture in the water? Well, I've seen them actually. And especially in sports like artistic swimming, where they're doing a lot of support in the lifts. I've actually had a few athletes have upper extremity, meaning their arms, end up with stress fractures, forearms especially, actually. And so that's very interesting. And then there's also land-based training. So a lot of the water athletes are so used to being in the water. When you start introducing land-based training, if they're not used to it, we can see these stress fractures happen as well in the legs and even in the feet. And so it is something to still think about, because stress fractures may not be on your mind in water athletes. Okay. So a dislocation then is where an end of the bone slips out of joint, right? And again, you may think, well, when is this going to happen in my water athlete? Well, again, with artistic swimming, interestingly, we have had a few from getting kicked, okay, underwater with a lot of those lifts that have to be supported, and especially the ones where they're being thrown in the air. We've seen some dislocations happen with that, shoulder, thumb, very interesting. And then even in swimmers, if they have really, really loose shoulders, they can have what's called subluxation happening when they're swimming, where the bone's slightly slipping out, but not necessarily coming out completely. It's usually some trauma that's going to have the bone actually completely dislocate um, in the water. And so, what is inflammation? What are people's understanding of what inflammation actually is? And again, you can either type it in the chat or raise your hand or just blurt it out.
This one is very complex because
Yes.
inflammation involves inflammatory cells that are related to infections, but I think this is more like volume with the volume, please.
You're
Um,
right. Yeah, keep going.
it's just uh, augmented volume of the tissue.
Okay, that's really good. So he's right. It's really complicated. So its simple form is it's an immune response by tissues to heal. Okay. And so what happens is exactly like you said, there's a complicated flood of proteins and enzymes and cells and substances that rush to the site of injury. So when your body senses there's been an injury, there's this immediate cascade of cells that react to rush to the area to try to help start healing it. Okay, so these different types of cells include white blood cells, different types of inflammatory cells, what we call inflammatory mediators, inflammatory proteins, enzymes. And so, what happens as a result of this is your blood vessels enlarge or they dilate. And so, because of that, you'll see redness and warmth on the skin surface if it's superficial enough. And the blood vessels also become very leaky. And so, this is where proteins and fluids lead into the tissue. And because of that, water also follows. And so, that's a property of physics. And so, with that, you see swelling. So, a lot of times when I give this talk, people will say it's swelling. Well, swelling is part of inflammation, but it's not the only thing that happens with inflammation. So, very good. That's exactly right. So then we'll talk about different injuries here. So what is tendonitis? Well, tendonitis then, by definition, itis, which is Latin for inflammation, means inflammation of a tendon, usually from overuse. Now, this type of inflammation is more commonly going to be happening in your youth, more so than it would in an adult, okay? So just something to keep in mind that the youth can still get inflammation. Adults can too, but we're going to talk about what happens more in your adult athletes. So instead, we see something called tendinosis usually happening, and this is used to be called chronic tendonitis, but we now know that's not really the case. It's not really chronic inflammation. And I'm going to go through that in a moment. So the symptoms are very similar to tendonitis, where people will have pain in a tendon region, but the pathology and treatment are very different. So there can be a genetic predisposition, meaning your DNA can program you towards having a predisposition to developing this problem in certain tendons in your body. And Overuse can certainly cause these symptoms to develop, or if you're starting to use a muscle or tendon in a new way that you just haven't your whole life, this can lead to developing symptoms. What really is happening is it's actually degeneration of the tendon. So collagen is the makeup of the bulk of your tendons and muscles, and they line up very parallel like this. And with tendon degeneration, they start to stagger a bit, and so they don't look parallel anymore. And so you start to weaken the tendon structure as a result of that, and can actually get little micro tears in the tendon and surrounding tendon sheath. And there's not really usually inflammation actually involved in this. You can really see this very well on ultrasound examination, also on magnetic resonance imaging. It can be difficult to treat. And there are, though, some nice things that we have in our toolbox, things like platelet-rich plasma injection, as well as what we call shockwave therapy now as well. So the good news is this doesn't necessarily mean the end of anyone's athletic career, and just something that needs to be addressed and hopefully recover from. So with that in mind, let's talk about what an injury is. So what are the symptoms of an actual injury? Okay, so I'll give you guys a few seconds to just think about that in your mind. What do you think an injury actually means? Okay. And so let's talk through that. So it's really pain that's actually sharp sometimes, and it lasts more than a few hours. Okay. It can also be a dull pain, and that can last more than a few days. And sometimes the pain in the beginning is sharp, and then it changes to become dull, and the pain can morph over time. Okay. And so you can have any of the following: swelling, redness, warmth, and bruising. But if an injury is very deep, sometimes you may not see any of this, okay, depending on where the injury is. Usually an injury is going to have lingering pain that affects your ability to function at a normal baseline level. At least the part that's affected just can't function normally. And it's usually going to hurt with use. Soreness. What's soreness? This is different, right? We've all had soreness, especially if you've had a break from activity and you come back into it. Your first workout, you may feel sore. And that's where you can have aching in a muscle that's worked beyond capacity. It's usually a sensation that actually goes away after you're warmed up. And there's usually not going to be any swelling, redness, bruising, or warmth with this. It can ache when you use the muscle, especially in the beginning. It can be a tight sensation at rest, but usually these resolve within 1 to 3 days, depending on how hard the muscle's been worked. So really, in summary, an injury is a medical problem that affects your ability to perform at your normal level. It's better to be safe than sorry. You want to see a physician, or at least whoever your healthcare provider is, sooner rather than later, because injuries that are diagnosed early can be treated very quickly and efficiently and lead to resolution, as opposed to long-term complications and other problems down the road that actually can affect your technique and your ability to really train at an efficient level. You always want to be seen for any injury that has any bruising and swelling, because it can be more serious than you think. And always starting rehab as soon as possible can lead to a much faster recovery. So, for example, even a simple ankle sprain can have long-term consequences because you lose your balance mechanism. And so rehabbing that to train that back is really critical. And so with that, any questions?
Please raise your hand if you have a question, put it in the chat, either or. We'll make sure that it gets answered, and you can ask in either language, and our lovely translator will make it possible for everyone to hear and understand. There's no stupid questions. You all,
Yeah, that's right.
please, everyone, go ahead, ask. Maybe it's something an athlete asked you, and you didn't know the answer, how you would answer an athlete. when the day comes when they ask you about their shoulder. Maybe some first steps. Maybe it's a personal question about your experience swimming, and because that would translate to your athletes with your knowledge.
Any question. That's fine. Are you all coaches, athletes? Who's on the call? You can put it in the chat if you want.
So I'll ask a question to get the ball rolling. How about that? Um, so what are you've worked across a couple different sports. What's some misguided advice that you've heard or seen coaches regularly or often give to their athletes around an injury?
That's a great question. And I would say it's not really just among those sports, but just in general, just among people that come into clinic. One of the biggest ones I hear is only ice for 24 hours or only ice for 48 hours and then heat. And that's absolutely not true. And I know ice has been a little bit controversial in some cases, just from some internet misinformation. I'll leave it at that. But there's fantastic evidence on ice helping. And anytime there's swelling, you really want to continue icing because the goal is you want to try to reduce the swelling so the tissues can come back together for healing in a faster way. And a lot of times the swelling is going to last you more than 48 hours. Heat, as you now understand inflammation, can make that swelling worse, right? So heat will help perpetuate the dilation of the tissues and ongoing swelling. And so really, really, you want to stay icing until the swelling is completely gone and the bruising too, actually. So there's no 48-hour minimum on or maximum on ice. And the other thing I will say is you want to really use actual ice. So putting ice in a Ziploc bag, use a paper towel to protect the area so you don't get freezer burn. And you want to ice for a minimum of 15 minutes.
And to follow up on what you just said, kind of what rest interval would you give between icings?
I think if you have something really acute, it's really swollen, every 2 hours is great. But I usually tell people 3 times a day in the beginning. That seems to be more realistic in terms of people's ability to ice.
So someone did ask, what in the chat, what are some kind of techniques and recommendations for muscle injuries on your experience? When
Yeah,
when an athlete has a muscle injury, what are some of the steps you go through?
right. So it depends on where the muscle is injured and how it's injured, so that's going to vary quite a bit. So, but in general, you want to be able to allow that body part specifically to heal, right? So if it's something where they can modify and avoid using that specific part until that heals, that's ideal. So they can continue training and using their body in other ways and cross training in other ways, staying in shape. So, you don't usually necessarily have to cast or sling muscle injuries in general. It just depends on how bad it is. Allowing that to rest, you want to maintain range of motion, you want to ice it, evaluate as quickly as possible to really understand what exactly happened, and then be able to give the advice of, okay, here are some exercises we can start with. A lot of times it's just range of motion first, and doing sometimes some isometric type of movements before you start getting into more dynamic strengthening, back to functional training, that type of thing. And again, it really just varies on the body part.
Thank you for that answer.
Mm-hmm.
I have a question.
Sure.
To make a right diagnose of uh, some lesion, some injury, excuse me, some injury in soft tissues, what is more recommended? An ultrasound or the other thing that is an
MRI.
MRI? Yes.
Yeah. Uh-huh. Yeah. So, ultrasound is so quick and easy if you have a doctor who has access to it in their office. So, for example, I have one in my office. They also have portable ultrasound. So, a lot of times, some teams will even travel with ultrasound. A lot of times at the venues, there will be an ultrasound available because they become much smaller and easier actually to use for some very simple, quick things. So a lot of times the ultrasound can give you a very quick answer, especially if the injury just happened. You have a very good idea of where it is and what it is, and then you can just confirm it and see it quickly. For something that's been going on for a lot longer and you're not quite sure where it is, an MRI is easier because an MRI gets the whole picture. Um, which are 3D slices basically using magnets and the properties of physics where you can see the injury on that. And sometimes the ultrasound, if the injury is too deep and the ultrasound quality is not good enough, it's not going to be able to see it. And so you would have to get an MRI in that case. But generally, ultrasound's fantastic for a very quick, easy diagnosis and a lot cheaper here in the US to do than an MRI would be, which may be the case in other countries too, but I'm not sure.
Awesome. Thank you for that. And the questions are rolling in now.
Okay.
Um, so a question about potential risks of injuries and regarding resistance and weight training and younger athletes. Like, what are some guidelines and higher risk activities that you might see when you're trying to begin weight training with young athletes?
Right. Okay. So that's a great question. So there's not necessarily an actual age where weightlifting necessarily can or can't start. I think in general, we see weight training, like if you're going to actually use bulk weights, not starting usually before age 8, but you can certainly use things like bands and conditioning and, non-weighted resistance and conditioning training, I think should be started as young as the athlete's starting to train type of thing. Okay. But in terms of actually using weights, those should start a little bit later, but can start as early as age 8 with very simple weights, but well monitored, making sure technique is done correctly and making sure that really that young athletes watch the entire time they're doing the actual full set of reps.
Perfect. Thank you. Next question is, what are some clues you can use to help identify overuse injuries when an athlete hasn't talked about it?
I think so, meaning that you can tell as a coach that they're trying to hide
Mm.
something. Is that the question?
I think my interpretation of the question, you could easily be right too. Umberto, maybe you could clarify. My interpretation was the athlete comes to you one day saying, "Hey, my shoulder hurts," but they haven't talked about it until that day, or like it may have been going on for months, but now they're coming to you and because it's kind of reached a critical point, let's say.
Okay. Yeah, so I think that's great because that ties directly into the talk, right? So that sounds like that's kind of your chronic injury that's been brewing and it's now reaching to a point where it sounds like the athlete's going to have to limit their training or it's affecting their training. Or you as a coach see that you can tell because you've been coaching them for a while that they're just not using a certain part of their body correctly. And it might be worth actually asking the athlete, hey, is your shoulder okay? Or is your wrist okay? Or is your elbow okay? You can sometimes tell. But I would say that that's a great place to say, hey, it's okay, injuries happen so that the athlete at least feels put at ease and that, you as a coach want to work with them to get them better so they can get back to full training, you know, quickly, right? That's the idea. And so I would encourage that athlete to be able to go see a sports medicine physician if possible to find out, okay, exactly what's wrong. Let's get that diagnosis. And then that physician would be able to direct treatment, whether it's physical therapy or what it may be, and then also be able to have a conversation about saying, hey, these are the things you're allowed to do with this injury, and this is what you have to limit. And if that physician can write that out or have a conversation with the coach as well, along with the athlete, then everybody's on the same page and can work together to allow that athlete to do as much as they can and participate while allowing that body part to heal. Mhm. I hope that answers the question, but if not, ask again.
That made sense on my end, but please speak up if that was not the answer you were looking for. Are there any other questions? Please ask it verbally. You can raise your hand, you can speak up, you can put it in the chat. Give it a minute or so. If there's a minute with no questions, then we will end our session then. I'll ask one more question, swimming focused, and then if anyone else has questions, please put it in the chat in the meantime, but maybe this is a good one to wrap up on. What are some injuries you've seen in kind of swimming specifically that might be often misdiagnosed or pair with another injury? Like they might lead to a secondary injury.
So I think, swimming, we all think shoulder, right? Right away, right? That's the body part that's used the most. And I think what happens is you can get so focused on the shoulder, you forget the neck. And a lot of times, again, with breathing and whatnot, the neck is also being utilized quite a bit. And interestingly, neck pain can sometimes refer to the shoulder. So someone might think it's just the shoulder, but the neck may also be involved. So that would be a great one to think about. And Dr. Miller is a swimmer, actually. So if you want to chime in, feel free if you have anything else to add to that.
I think your point is well taken. And many times the injury or the overuse aspect to the stroke has to do with the technique that's being used for the stroke. Obviously, a sudden increase in the intensity or the volume of the exercise will set you up. But if the technique is not sound, then you're setting yourself up for injury to that joint slash muscle slash tendon, whatever. So all four of the strokes have very different techniques and very different uh, methods of training, drilling, and learning it correctly. And I would strongly encourage if somebody's trying to pick up a new stroke, that they receive coaching to help them do that and not set themselves back. In masters, I'll see all the time a masters athlete come up to me and say, I want to learn butterfly. And they may go for an entire month just doing drills, learning that sine wave motion through the water before they actually do the entire stroke.
Right. Thank you for that. And in that time, we had two more questions come up. So this one might be a little tricky because it's going to be on a case by case basis. But how do you know, or what are some indications when an injury should lead to an athlete's retirement? Like when should an athlete recognize that this isn't what I should be doing? This is not what's best for my long-term health, or a coach recognizing that.
Yeah, I agree. That's really tough because I think it would really depend on the scenario. I mean, it's probably one of those where you're kind of looking more at this chronic tendon related issue. Sometimes arthritis can lead to that in certain cases, more of your land-based sports probably than your water-based sports, I would say. Actually, we tend to recommend water-based sports for people with arthritis in most cases, but a neck could be a neck arthritis could be a rate limiting step for somebody, especially if they're just having trouble turning their neck right at that point for swimming to be able to breathe appropriately, or just an injury that someone is just not able to recover from, um, something like that. But I think that's a question where that's where it's really helpful, I think, to also have that physician involved who knows what's going on with that case, to have them give their input on that front as well. And I think too, if you just keep getting injured over and over and over, especially in the same area or potentially different areas, then I would not necessarily look at needing to retire first, but maybe looking at your nutrition. Because is there something going on where potentially you're lacking adequate actual carbohydrates, which your muscles need? Protein, looking at those things. So that's where I would say it's important to see a physician first, because there could also be something going on from a medical perspective, something like a thyroid disorder or blood sugar, something like diabetes, or could be some other contributing factor into why someone is getting injured before they just throw in the towel and stop. So I do think it's helpful to talk to a physician first and make sure that everything's ruled out so you don't really have to necessarily stop.
Okay, we've got two questions. I'm going to use what you were talking about there to build off for one of them. What are some potential, so just taking swimming athletes, what are some swimming specific ways or methods you think that might be more friendly for swimmers to recover from a muscle injury? Are there specific approaches you might recommend?
Yes, so usually we like to get our physical therapists involved because there are some fantastic rehab exercises that can be done depending on what's injured, right? So again, we usually will start with things like range of motion, isometric strengthening, strengthening all the muscles around, and also looking at mechanics. Are there certain muscles that are weaker than others that are contributing to why an athlete might have injured this certain body part? So looking at all of that to strengthen all of that. We all talk about the core. The core is very important. So are the outer abs. So all of the ab muscles are important. And a lot of times there's weaknesses and imbalances in that. So is there, is one side stronger than the other, and looking at that. So we may look symmetric, but we're not symmetric actually in terms of how we function. Um, so it really is not just focusing on the body part that's injured, but looking at everything else that could have contributed to that injury and trying to optimize the balancing of how all of the muscles are working together, if that makes sense.
That makes sense to me. And what is for now our last question? What are some things that might be going on if a swimmer seems to have pain, but it's moving around? Like one day they say, "Oh, my hip is sore, my hip is tight," but then the next week they're like, "Ah, my knee hurts."
Mhm.
What are some things you might look at in a case like that?
So I think one is, okay, what is the training regimen, right? So what strokes are we working on? What's changed? What are we doing for conditioning? And so are there certain muscle groups then that are weaker? Same kind of concept. And what's happening with technique, right? So being able to get in the water with that swimmer, ideally being able to look underneath what's happening to their stroke, in addition to being on the pool deck and looking and seeing what's going on. And a lot of times it's even the breathing technique, what's happening there. It could be as simple as that. And how are they compensating for that breathing technique in terms of how they're using their um, muscles? And Jim, feel free to chime in because, again, I know you're giving a great talk on sort of this topic really coming up soon at World Aquatics. So, mhm.
also need to consider is, are they nutritionally sound?
Mhm.
You know, are they getting the correct fuel for the strokes that they're doing? Did they launch into a stroke as opposed to launch into the drills to do the stroke correctly? Those types of things. So I think you have to look at the components that led to that, particularly if it's rotating to different locations. The other thing, of course, is the obvious, is that if you're seeing different locations becoming inflamed at different times, do they have an underlying arthritis that needs to be investigated and addressed so they don't have joint-related injury from whatever activity they're doing?
Perfect. Thank you for that. Next question is around injury and competition. About what point do you recommend that? Is there a point where you recommend that they push through it for the sake of one race? Okay, you can deal with it for one race, but yeah, I'll let you speak to that. It's a tricky one.
That's a really tough question because I will say that's such an individual decision, and it really depends on what the injury is, where it is, and how it affects short term and long term. So in making those kind of decisions, because we've all done that. That's part of what we do as sports medicine physicians when we're taking care of these different teams. Is you know always having that very open, honest discussion with the athlete of, okay, well, here's if you compete with this injury, this is directly what could happen short term, but you also want to think long term because you want to make sure that they're not compromising the next Olympic Games if that's their aspiration for this one race. And it also depends on what race. If it's the Olympic Games that they're competing in, they're probably going to push through almost anything to make that happen. I mean, this has been the lifelong dream that most athletes are going for. If it's a very simple meet that really has no repercussion, it's probably not worth pushing through that for this for both the short term and long term, frankly, because they want to have ideally a good rest of the competition season. So that is extremely individual based on all of those different circumstances. Mhm.
Thank you for that. I think that's a good answer for a very tricky question.
Mhm.
In addition to that, is depends upon the sport or the event that they're entering.
Mhm.
Somebody wants to push through 100 freestyle. Okay, I get that. But I will frequently have the athlete come up to me and their next event is the 10K in open water. Completely different animal with multiple more rotations and more risk to it.
Yeah, thanks for that clarification. That's that very individual decision.
Yeah, very different ball game to push through the pain for 100 meters versus 10 kilometers, and a lot more time to worsen an injury in that span.
Right.
I think that is all of the questions for now. Can you speak to, there's a kind of a question, and I think the translation of it's coming off a little awkward and between it, but can you speak to warming up an injury? Like how might you adjust warm-ups for an injured athlete? What are some things you might look at to prescribe a let's say an injury prevention focused warm-up?
Injury prevention focused warm up. So I am a huge fan of cross training. I think that is the key, actually, to that. And I think that warm up should include not only stretching, but it should include some strengthening, and it should include um, cardiovascular, meaning heart rate focused type of workout. And it really can be tailored to the sport but should really make sure that it's including all the body parts that could be used for that sport. And the core has to be part of it for every sport. That's very important. Not only core, like plank type of stuff, but also abdominal exercises. And so I do think that, ideally you start with some cardio to warm all the muscles up, do your strength training, do some stretching once everything is warmed up. And that's in general a potentially good recipe, but not always. It depends. The stretching component sometimes may need to be done at the very end of training, because sometimes when you stretch, you can lose the economy and fast twitch muscle reflex response that you really want during training. So I would say the stretching part of things might need to be the end of training, but the warm-up part should include at least cardio and strength work. And that should really be a part of every day's training, to where you're training the muscles in a different way than you're about to use them in the water. So land-based training, I think, is very important for your water sports.
Perfect. Thank you for that.
Mm-hmm.
We have one person who asked if they could ask another question. I'm just kind of waiting for it to come up in the chat. So might be a little less swimming focused, but are there any differences for warm-ups when you're considering impact versus non-impact?
In terms of how you should do the warm-up, is that kind of the
Yeah.
question? I think, yes. I mean, I think, again, so for someone that's training to run, they're going to be doing a lot more impact type of cross training. And your swimmer doesn't have to basically do the same kind of a cardiovascular running type of warm up that your land-based runner would need to, right? But so I think it is, finding ways to incorporate land-based training, which I think is good for your bones in general. So you do want to have a little bit of impact, because that's good for bone strength for your whole life, and not just have it all be focused on water, if that makes sense. And, by the same token, a lot of your land-based type of sports, it's good to do some non-impact type of training as well, which is where some of the strength training comes into play and things like that. But, so for swimmers, the obvious cardio is to do lots of laps, which they're going to be doing anyways in training. So it's not a bad idea to do a little bit of impact plyometric training on land, but it doesn't have to be the majority of your warm-up type of thing. It'd be better to focus more on things like core and strengthening the other muscles again, so that those can support those athletes in the pool, in the water. Does that make sense? Or address the question?
I think so. They answered thanks in the chat, so I think that was a great answer. Are there any more questions? Please speak up or put it in the chat. If so, I'll give you about a minute to do that. Raise your hand if you're trying to type something and just trying to find the words, and we'll hang on. But otherwise, we will begin to wrap up.
Really good questions so far. Really appreciate it.
There's some great discussion questions there. So thank you everyone for all of your involvement and engagement there. It's great to have these questions. It really adds to the depth and value of a session like this. And I'm going to call the questions here, but if you're trying to type, please raise your hand and we'll give you a bit of extra time. I think that was all of the questions. So great job answering all of them. Thank you so much for your time and expertise. It's great. And hopefully these questions and learnings make their way out to the communities and help swimmers be more healthy. Do Selena or James, do either of you have any comments to wrap up?
I would have, what a great job, Selena, and very organized, and the questions you guys asked were right on target. Thanks so much.
Yeah, thank you so much. I appreciate everybody listening and taking the time on a Saturday. And let us know too, if there's any other topics that you all are interested in us speaking about from the medical perspective, that will really help us because we want to make this for you. And so we want to make sure that we're giving talks that you all are interested in. So feel free to ask other coaches that weren't able to attend, your athletes, what are things that they want to learn from us as part of the Pan American Medical Committee, because we're here for you. So we want to make sure that we're addressing what your needs are.
Perfect. Lots of thanks in the chat. So thank you for your expertise. Thanks for doing this. And with that, we'll wrap up our session for today. Thanks again. The recording will be made available in the next couple of days, and I hope that you enjoy the rest of your weekend. Thank you.
Thank you.